Panorama is a DNA-based, non-invasive prenatal screening test, or NIPT, from Natera. It assesses the risk of a fetus for certain chromosome abnormalities and can also determine the fetal gender. Unlike invasive prenatal diagnostic tests that can have a risk for miscarriage of between 0.5 and 1%, Panorama is a simple blood draw from a woman's arm, and it does not have any risk to the fetus at all. Panorama is done by analyzing placental cell-free DNA that's circulating in a pregnant woman's bloodstream. Panorama is a highly accurate screen. In fact, it's much more accurate than traditional serum screening, but it does not provide a definitive diagnosis, and there is still a small chance for a false positive or a false negative. CVS, or chorionic villus sampling, and amniocentesis are invasive diagnostic medical procedures that test for more conditions than Panorama. If there is a patient that wants definitive answers or the maximum amount of information, then an invasive diagnostic test may be the best option for her. If the Panorama test comes back indicating a high risk for a chromosome abnormality, it is recommended that a woman pursue an invasive diagnostic test like CVS or amniocentesis to confirm the finding. Alternatively, a woman may decide to have her baby tested after delivery. In addition to screening for certain chromosome abnormalities and fetal sex, Panorama can also screen for 5 microdeletions. These syndromes are caused by a small missing region on a chromosome. CVS and amniocentesis do not typically test for microdeletions. These procedures routinely involve a karyotype, which will miss most microdeletions. If Panorama comes back indicating an increased risk for a microdeletion, a CVS or an amniocentesis should be offered with a microarray and in some cases other studies. Panorama is an excellent way to screen a pregnancy for certain chromosome abnormalities and for microdeletions. With proper patient counseling, Panorama can be a vital tool to prenatal care.